warm welcome to AD4TV Radio News Update, coming to you live from Abuja, Nigeria's capital territory. I am AD4TVRADIO Dada. Nigeria's President Muhammadu Buhari, in a teleconference with the Presidential Task Force on COVID-19 in Abuja this Wednesday, asked the task force to put in more effort in tracing contacts of those infected with the virus to stop the community transmission. He also asked the task force to flatten the infection curve as quickly as possible. The Minister of Humanitarian Affairs, Disaster Management and Social Development, Hajia Sadiya Umar, responding to questions from State House correspondents in Abuja, says urban poor dwellers with an account balance of 5,000 naira or less will be among the beneficiaries of the federal government conditional cash transfer scheme. She stated that the prospective beneficiaries will be part of the additional 1 million households approved by President Muhammadu Buhari to boost the nation's social intervention register. The president had on Monday, the 13th of April, in a broadcast instructed that the current social register be expanded from 2.6 million households to 3.6 million in the next 2 weeks. The National Assembly has advocated for the establishment of a funds management committee to administer donations from individuals and organizations in support of the ongoing crusade against COVID-19 pandemic in the country. Senate President Ahmed Lawan made this call at the end of a strategic engagement between President Muhammadu Buhari and the leadership of the National Assembly over national issues at the State House, Abuja. Lawan, who was in the company of the Speaker of the House of Representatives, Femi Gbajabiamila, stated that the committee, when constituted, will ensure proper and effective utilization of the various donations made so far.
Coronavirus, they really make you do wetin you fit today, can't wait. Now the cocoa thing where you owe yourself be that because it's better to survive than for water to run your eyes. Oya waka boom boom begin the use hand sanitizers, facial mask, and not gree for gumbody at all for anywhere, especially where people boku. Clear road, arrange yourself, keep social distance and practice good hygiene for house and surroundings. Do wetin government tell you, sit down for house and make it for no loss. Coronavirus dey, so make we gree together, waka fight am like a kozuna.
I'm appeal to Nigerians is that please, let's obey the social distancing. Let us obey the personal hygiene. Wash your hands. Don't go into congregation, and within 2 weeks, you go back and resume your normal life. If we don't do the right thing, we are going to face a disaster that we will not be able to handle.
This message now from the News Agency of Nigeria, NAN. They can't pay.
Meanwhile, the Nigeria Center for Disease Control, NCDC, this Wednesday reported 34 new cases of COVID-19 in Nigeria, 18 in Lagos, 12 in Kano, 2 in Katsina, 1 in Delta, and 1 in Niger State. As at 11:20 p.m. the 15th of April, there are 407 confirmed cases of coronavirus reported in Nigeria. 128 have been discharged and 12 deaths. In a press statement released this Wednesday by Anthony Ogunleye, the Chief Press Secretary to the Minister of the Federal Capital Territory, the FCT Coronavirus Security Committee, chaired by the Minister, Malam Mohammed Musa Bello, has issued new directives as measures to contain the spread of coronavirus in the capital. The directives include: market operational days are henceforth reduced to twice a week, Wednesdays and Saturdays only. Residents should only patronize neighborhood markets, as movement from one district to the other now constitutes a violation of the lockdown rules. Mobile courts will now be activated to try all violators of this directive on the cessation of movement across the Federal Capital Territory. Motorcycles are henceforth barred from operating anywhere in Kubwa and Dutse Alhaji area of the state during the lockdown. The Federal Capital Territory Administration will step up sensitization efforts, especially in the rural communities, and urge area council chairmen, traditional rulers, and community leaders to actively engage in sensitizing the populace on the dangers of COVID-19. The statement added that the FCT administration remains deeply committed to ensuring that the coronavirus pandemic is controlled in all areas, both rural and suburban communities. A Nigerian doctor in private practice died of coronavirus-related complications this Wednesday. after treating an infected patient at his hospital. The doctor, identified as Dr. Chubuemeka, who died at the Lagos University Teaching Hospital, Luth, was admitted to the hospital on Monday, while the patient he was treating died on Friday, the 3rd of April 2020. Confirming this development, the Chief Medical Director of the Lagos University Teaching Hospital, Luth, Professor Chris Bode, said the doctor was not a staff of the hospital, but was rushed to the facility after he showed severe signs of the disease. The governor of Kaduna State, Nigeria, Malam Nasir El-Rufai, on Wednesday said he's yet to be cleared of the coronavirus and is still in isolation. El-Rufai, who chaired a virtual meeting of the State Executive Council for the first time since he was diagnosed, said he will personally announce to the public as soon as he is confirmed negative of the disease. He also urged citizens to ignore reports stating he'd been given the all clear. The Federal Consumer Protection Commission this Wednesday sealed an allegedly illegal plastic surgery clinic in Lagos State, Nigeria. The clinic, Med Contour and Body Contour Specialist, operates from a two-story building located at number 11A, Ladi Alakija Street, Lekki Phase 1, Lagos State, Nigeria. The Chief Executive Officer of the Commission, Babatunde Irukera, said sealing of the place became necessary following several complaints that the activities of the clinic are not only unprofessional and misleading, but potentially dangerous to people's health. And moving on to the international scene, the World Health Organization's chief, Tedros Adhanom Ghebreyesus, at a virtual news conference in Geneva on Wednesday, voiced regrets at the United States President Donald Trump's suspension of funding for the WHO, following accusations that it had mismanaged the response to the COVID-19 pandemic. The WHO boss has, however, rejected claims that the organization had mismanaged or underestimated the severity of the outbreak, pointing to the increasingly urgent warnings about the situation in early January. Tedros Ghebreyesus says the WHO is reviewing what the cut by the United States will do to its operations, adding that the organization will work with its partners to fill any financial gaps and ensure work is uninterrupted. He noted that, as is usually practiced, the WHO's performance in tackling the pandemic will be reviewed by member states and independent bodies that are in place to ensure transparency and accountability.
Coronavirus, they really make you do wetin you fit today, kampe. Now the cocoa thing where you owe yourself be that because it's better to survive than for water to run your eyes. Oya waka boom boom begin the use hand sanitizers, facial mask, and not gree for gun body at all for anywhere, especially where people boku. Clear road, arrange yourself, keep social distance and practice good hygiene for house and surroundings. Do wetin government tell you, sit down for house and make it for no loss. Coronavirus dey o, so make we gree together, waka fight am like a kozuna.
I'm appeal to Nigerians that please, let's obey the social distancing. Let us obey the personal hygiene. Wash your hands. Don't go into congregation, and within 2 weeks, you go back and resume your normal life. If we don't do the right thing, we are going to face a disaster that we will not be able to handle.
This message now from the News Agency of Nigeria, NAN. They can't pay.
The British government is set to evacuate its citizens currently in Nigeria from the 18th of April in both Abuja and Lagos airports. According to a statement from the British High Commission, signed by the Senior Press and Public Affairs Officer, Chris Ogumodede, those to be evacuated are British citizens in Nigeria with residential addresses in the United Kingdom. The affected persons are to pay a fee of below £500 for the flights, which begin this Saturday. 3 whistleblowers who tried to inform the world about the true scale of the coronavirus outbreak in Wuhan have been missing for 2 months. The whereabouts of Chen Qishi, Fang Bing, and Li Zehua have been a mystery since February, and Chinese officials are yet to publicly comment on them. Chen Qishi has not been heard from since the 6th of February, after his arrival in Wuhan, just before the city went into lockdown. His disappearance was revealed by his friend and mother, who've been calling out for his return, stating they've been unable to make contact with him for 68 days. Fang Bing went missing on the 9th of February, after releasing a series of videos, including one showing piles of bodies being loaded onto a bus. According to reports, Fang Bing was arrested briefly, then released before his disappearance. Li Zhenhua, a former employee of state broadcaster CCTV, was reported to be last heard from on the 26th of February. A United States congressman has, however, called on the State Department to pressure China to investigate disappearances of the 3 journalists. And that's it on AD4 TV Radio News Update, coming to you live from Abuja, Nigeria's capital. You can join the conversation on our social media platforms at AD4 TV Radio on Facebook, Twitter, LinkedIn, and Instagram. Please subscribe to our YouTube channel at AD4 TV Radio. Many thanks for watching. I am Adirayo Dada.